You have had open heart surgery and are getting ready to go home. In this video, the following questions will be covered. What can I expect when I go home? How do I care for my incisions? What do I do if I experience breathing problems, pain, difficulty sleeping, or constipation? What activities should I avoid? What can I do to avoid another problem with my heart? And what do I need to follow up with?
Once you are home, you may experience the following: fatigue or low energy. Initially, you may feel very tired and experience low energy. However, over time, your energy level will increase.
Many patients who go through cardiac surgery often experience several post-operative emotions, such as anger, depression, and stress. If you experience any of these emotions, know that this is common and that there are several resources in the Heart Center to help you through this difficult time. It can take weeks to months for your sternum to heal. During this time, it's common to experience incisional pain. Pain management strategies will be discussed more thoroughly later in this video.
Many patients have a difficult time falling and staying asleep when they return home after surgery. It is important to keep in mind that this is temporary.
Helpful tips for getting a good night's sleep will be discussed later on in the video. Remember, these are all common concerns after surgery, and as you progress through your recovery, these side effects should improve.
How can I care for my incisions?
It is important that you inspect your incisions every day. You are looking for any signs of infection, such as redness, tenderness, swelling, or drainage from the incision site. Fever above 38 Celsius or 101 Fahrenheit. If you see or experience any of the above, please contact your family doctor. When showering, avoid direct pressure from the shower on your incision. You may use soap. Avoid rubbing your incision. Pat dry with a clean towel. Do not apply creams, lotions, or antibiotics to your incision. Don't forget that caring for your incision includes maintaining your sternal precautions. Your sternum is held together with permanent wires, and it takes 8 to 12 weeks for your sternum to heal. Follow the exercises and activities outlined in your cardiac surgery patient guide and what was taught to you by the physiotherapists and nurses.
What do I do when I experience?
If you are short of breath, try your deep breathing exercises. If your breathing continues to worsen, see your family doctor. And if your shortness of breath becomes distressing, call 911. It is important to note that your shortness of breath may be caused by pain. Therefore, taking a deep breath may be difficult if your pain is inadequately managed. If you develop a new or worsening cough with or without sputum production, please contact your family doctor. It is common to experience incisional pain. Continue using regular Tylenol or your prescribed pain medications as needed. As you recover, your pain should improve and your need for pain medications should lessen.
If pain is affecting your sleep, take your pain medications during the day, right before bedtime, and again if you wake up in the middle of the night. If you find that your pain is worsening, contact your family doctor. Difficulties falling or staying asleep. Here are some helpful tips to help you get a good night's sleep. Wake up at the same time every day. Avoid napping during the day. Save your bedroom for sleep only. Avoid watching TV before bed. Limit your caffeine intake. You may be given a prescription for sleeping pills for a short period of time. If you are having difficulty sleeping, do not be afraid to use them. Constipation. It is important to have regular bowel movements and avoid straining. Here are some tips to promote regular bowel movements. Increase your fruit, vegetable, and fiber intake. Ensure you are staying hydrated, but be mindful of any fluid restrictions. Use over-the-counter laxatives if needed. Contact your family doctor if you have not had a bowel movement in over 3 days.
What activities should I avoid? What can I do to avoid another heart problem?
Make sure you take your medications as prescribed and consult your family doctor first before stopping any of your medications.
Upon discharge, you will receive a heart disease risk factor screening tool. This tool provides information on how to control the following.
Smoking. Quitting smoking is the single best thing you can do for your health. To help you quit, ask us about our Quit Now package. Nicotine replacement therapies are available if you are interested. High blood pressure. To help control your blood pressure, remember to take your medications, maintain good physical activity, limit your salt intake, and try to limit stress in your life. If you have diabetes, it is very important to control your blood sugar to protect your new arteries. You can control your blood sugar with diet, exercise, and prescription medication. A low-fat diet is encouraged to prevent new plaques from forming in your arteries. This will decrease the chances of developing new blockages. To optimize your heart health, limit your intake to 1 per day for females and 2 per day for males. During your recovery, your exercise tolerance will increase. Work towards completing up to 30 minutes of activity each day. We encourage you to take part in your local cardiac rehabilitation program to support your exercise activity. If you are overweight, talk with your family doctor about setting and achieving a goal weight. Losing weight can help control blood pressure, cholesterol, blood sugar, and make you feel better.
It is important to note that all these risk factors are modifiable and can be minimized.
What do I need to follow up with?
After discharge, you will have several follow-up appointments. You will need to make the following appointments. An appointment with your family doctor within 1 week of your discharge. An appointment with your cardiologist in 6 weeks. And if you do not have a cardiologist, your family doctor will refer you to one. An appointment with your cardiac surgeon is optional after 12 weeks of discharge.
You may be required to have blood tests after you leave the hospital. If this is the case, you will receive a lab requisition with further instructions. If you live within Vancouver Coastal Health Authority, we will refer you to a cardiac rehabilitation program. You will be contacted a few weeks after being discharged to set up your first appointment. If you live outside this health authority, ask your family doctor to refer you to a local rehabilitation program. If you have any non-emergent questions or concerns regarding your health, you can call 811 to speak with a nurse, dietitian, or pharmacist who will be happy to answer any of your questions. You will be going home on new medications. You will be given a prescription and a schedule of when to take your medications. It is important to take your medications as prescribed.
If you have any questions regarding your medications, further information can be found in your cardiac surgery patient guide. You may also refer to your local pharmacist or family doctor if you have any other concerns.